Hello everyone, my name is Yunzhi. I'm a PhD student from the Human-Computer Interaction Institute at Carrington University. Today I'm excited to share our work, Breaking the Inescapable Cycle of Pain, supporting wheelchair users' upper extremity health awareness and management with tracking technologies. Co-authors are Franklin Lee and Patrick Carrington. Upper extremity health issues are prevalent in wheelchair users, with studies reporting that 35 to 78% of paraplegic individuals experience shoulder pain, and about one-third of spinal cord injury patients experience pain in other upper extremity areas, such as elbow and wrist. Behind the pain is prevalence of upper extremity injuries, equal to shoulder impingement, rotator cuff tears, etc. To this, one major factor is that unlike our knee joints, our upper extremities are mostly optimized for mobility and increased range of motion instead of stability, which results in their non-weight-bearing nature. Further on top of that, wheelchair users have to rely on the upper extremities for many essential daily activities, which are indeed weight-bearing, such as propulsion, transfer, push-ups, and overhead reaches, which put increased load and repetitive stress on their upper extremities and therefore increase the risk of getting both overuse and acute upper extremity injuries. Moreover, upper extremity health is critical to wheelchair users, as it's not only about their physical wellness, but also their independence, mental well-being, and social participation. There are a few treatment options available under the traditional provider-patient framework, including surgical repairs, which are often reserved for extreme situations, and conservative treatments like manual therapy or medication, which may bring temporary relief to symptoms, but typically do not lead to sustained health improvement. Here, it is important to consider two key factors behind the injury mechanism, including one's inherent ability to perform physical tasks without experiencing pain, which is their capacity, and the required actions or motion to perform certain tasks, which is the physical demand. Furthermore, what makes upper extremity health issues particularly challenging is that wheelchair users must consistently balance these factors on a daily basis. This is a lifelong dynamic process which requires active engagement. Therefore, supporting wheelchair users' day-to-day self-care, especially injury prevention, can be particularly crucial. Recent progress in HCI shows that patients' self-care can be effectively supported by health tracking technologies across a wide range of health contexts, including mental health and chronic conditions like diabetes and multiple sclerosis, etc. But for wheelchair users specifically, most of the existing tracking research has been limited to wheelchair kinematics tracking and fitness tracking. Notably, recent literature has begun to investigate how health tracking technologies can support wheelchair users' self-care on bladder dysfunction and pressure ulcers. Still, wheelchair users' upper extremity health has received much less attention from the HCI community. So in this work, we aim to investigate how health tracking technologies can support wheelchair users' upper extremity health self-care. To do that, we conducted a semi-structured interview study with 12 wheelchair users and 5 therapists to understand current practices and challenges around upper extremity health management, as well as potential benefits of health tracking. We then transcribed and collectively coded the interview data, later performed semantic analysis and affinity diagramming, which resulted in 4 high-level themes. Here is an overview of the 4 themes. Due to time constraints, here I will mainly address Theme 1, wheelchair users' current health management practices, and Theme 3, the challenges they encounter. First of all, we found that wheelchair users' current engagement in upper extremity health management can be well characterized as a cycle of pain. Now let me walk you through that cycle. As we mentioned earlier, the repetitive upper extremity demand associated with wheelchair usage are likely to cause some upper extremity injuries. You may think that they then go to see a therapist and receive some treatment to get their injuries fixed. But in reality, we learned that there are some nuanced middle stages before one wheelchair user actually go to see therapists. First of all, there is a tolerable pain stage, as we learned that most wheelchair users have an expectation of living with pain. Like W4 said, it's like you get up in the morning and put your glasses on. I get up in the morning, my shoulder hurts, and it's just my shoulder, it's just gonna happen. I just kind of accept it and deal with it from there. Drawing from their clinical practices, one therapist also commented that the expectation in wheelchair users' mind is that it's typical and normal to feel pain, and they're willing to live with a certain amount of pain. So with that, wheelchair users will only go to see therapists when pain escalates beyond their expectation or some mobility level declines occur, such that they cannot independently transfer anymore. Further, even after they see a doctor, the rehab will likely stop at this tolerable pain stage and further repeat the above process. Taken together, we learned that wheelchair users often find themselves in this cycle of pain, and many wheelchair users actually rely on pain to stay aware of their upper extremity health, like W8 encapsulated. It's sad, but a lot of times it's the pain that starts talking to you, saying this is what's going on now, you need to pay attention. Also within that cycle, there are a few injury prevention strategies exist, such as using power chair's built-in function to avoid overexertion and utilizing external mobility assistance, like power assist or even service animals. In terms of existing challenges of upper extremity health management, limited resources for wheelchair training and health education, as well as external factors such as environmental and financial barriers, were found to hinder one's upper extremity health management. Another challenge is the competing priorities, as wheelchair users often struggle with balancing between their upper extremity health with social engagement and some other health issues, such as bladder dysfunctions, which are more often prioritized. In addition, we learned from therapists that wheelchair users' body mechanics are directly correlated with their injury risk and rehab outcomes. However, most of the participants were not consciously aware of this critical information. Apart from the factors of limited training, one therapist further brought up the challenge of proprioceptive difficulty, which is rooted in human motor cognition. Taken altogether, the set of findings we got collectively contribute to a foundational understanding of the current state of wheelchair users' upper extremity health management. For example, we learned that despite the broad consensus on the importance of upper extremity health, most wheelchair users report to rely on pain and ability level function decline for health evaluation, which often leads to binary and belated understanding of their upper extremity health. We also illuminated a set of social, environmental, and intrinsic factors that affect wheelchair users' upper extremity health management, and found interesting parallels between upper extremity health management and wheelchair users' other high-frequency self-care activities, multi-mobility in older adults, as well as chronic pain management. Please check our paper for more detailed discussion on this. In addition, informed by the findings, we see a clear opportunity for health tracking technologies to facilitate wheelchair users' upper extremity health self-care and eventually empower them to break the cycle of pain. Here, we contribute 6 design implications, including not only quantify but also qualify the movement, elicit capacity understanding, employ semi-automated tracking to solidify experience, facilitate wheelchair skill learning, inform wheelchair users' awareness on the relevant external factors, as well as recognize the diversity among wheelchair user population. For this video, I will go over the first 2 in more detail. First, as mentioned earlier, wheelchair users' upper body mechanics are critical yet often overlooked information in their everyday lives. We see a clear opportunity for health tracking technologies to automate such a process by applying appropriate motion tracking techniques. To this, beyond existing performance-oriented tracking metrics such as push speed, travel distance, etc., we further highlight several quality-oriented metrics such as range of motion, elbow position over time, etc. Further, different from what fitness trackers are dealing with, which is the risk of being too little, upper extremity health tracking technologies to recognize the risk of being too much, as inefficient but high-quantity motions can significantly increase the risk of overuse injuries. Beyond monitor wheelchair users' body mechanics, help capture one's upper extremity capacity and inform activity planning can be equally important. Developers may apply appropriate active learning techniques to automatically capture one's capacity, or apply the analytics tool to facilitate wheelchair users' self-exploration. Here, developers should also consider balancing the increased mental workload in presented upper extremity health information, since many wheelchair users prominently struggle with competing priorities and limited bandwidth. In addition to design implications, our findings also informed us on some potential future directions, including developing inclusive upper body motion capture system and collaborative upper extremity health management through data sharing. Last but not least, wheelchair users' expectation of living with pain suggests that a more general mindset that correlates wheelchair usage with unhealthy lifestyle may exist across different health contexts. Existing research suggests that negative mindset reduces people's self-efficacy and perceived health. We believe wheelchair users' mental model on various self-care activities, as well as their forming factors, need to be further understood, which will further inform us on technology design and deployment to eventually reshape wheelchair users' inescapable mindset of pain and injuries. Thank you for your attention, and please read our paper for more detailed findings and discussion.